And hello, everyone. As Sybil said, my name is Juliet Mabasa, and I am going into grade 11 at Little Flower Academy. Thank you so much for giving me this opportunity. So, along with my dad, Dr. Vincent Mabasa, I have been working on a project to present opportunities for environmental sustainability within the intensive care units across British Columbia. And this was a topic that my family was talking about during dinner time, and I thought it was important, so I decided to do more research into it. So let's begin. Climate change is the change of climate due to the greenhouse effect. And the greenhouse effect is a process that is affected by greenhouse gases, for example, carbon. When the sun rays reflect off the earth, these greenhouse gases form a blockage in the atmosphere so that the rays are trapped. And as a result, the rays bounce around on the earth and the earth heats up. The greenhouse gases also have another effect, which is ozone layer depletion. And when these gases are emitted, they puncture a hole in the ozone layer by breaking down ozone molecules. So the ozone layer cannot shield us from harmful UV rays no more and will affect everyone on Earth. Canada emits around 670 megatons of carbon dioxide per year, and of this, hospitals contribute to about 4.6% of Canada's total greenhouse gas emissions. Here's a chart that shows the contributing factors of the hospital's greenhouse gas emissions. The biggest factors, as we can see, include manufacturing and distribution, medicines and chemicals, and medical and non-medical equipment. What do all of these items have in common? Well, they were all examples of single-use plastic waste from hospitals. And as shown in the graph previously, more than 40% of greenhouse gas emissions actually come from medical and non-medical waste. But how? When disposed of, these single-use plastics, along with the pharmaceutical waste, eventually end up in the water or in our environment as seen in the picture. And this is because they break down into microplastics, which can end up in our bodies through consumption or inhalation. These plastics can also end up harming animals and cause habitat destruction, which is the sole cause of over 100 million animals' deaths per year. The waste can also end up in the incinerator, which is harmful to us and the environment because it produces carbon monoxide, acid gases, nitrogen oxides, and cancer-causing dioxins. So as we can see, there's several areas for improvement with medical and non-medical waste in the ICU. So what can we do about these? Well, first of all, patient information on blood work and diagnostic results are printed automatically and placed in the chart usually, and this information is rarely used by the physician and staff. So one recommendation is to stop printing unnecessarily and keep things online instead, although it varies depending on which hospital. Next, the picture shown is a bag of medications destined to go from the ICU to the pharmacy, and there are bags for the bags, and the bags for the bags for the bags. So why are there so many bags? In order to reduce the amount of single-use plastics used for this packaging, we can instead use wipeable reusable containers like these, and they can be readily found and have been used in other sites across BC, such as Surrey Memorial Hospital. Due to the amount of IV bag and tubing wastage, the ICU could step down to oral medications sooner than later as well. This will reduce the plastic waste, and there's usually less medication costs and less work overall. This picture is taken in the Burnaby Hospital ICU, and it shows unused medications that are thrown away. And these unused medications can instead be reused by sending the unused medications back to the pharmacy for quarantine and reuse. The cost of medications will be credited back to the unit, and the unit will save money, and there will be less medication wasted. However, it will take pharmacy manpower to credit and reuse the medications. Similarly, when a patient is discharged, all the medical supplies are discarded, as seen in the photo. So instead, medical supplies can be reused after sufficient disinfection. And this is beneficial for the hospital, again, as it decreases hospital spending for medical supplies by conserving the resources. However, it can take time to quarantine and separate the unused items. Next up is medicines, which contribute to over 25% of greenhouse gas emissions from the hospital. So in this study, we highlighted a few medications and non-medical waste products that contribute to environmental harm. The first being metered dose inhalers, because it contributes to a quarter of the effects of the medication greenhouse gas emissions. Over time, it has progressed from the chlorofluorocarbon inhalers in the 1950s, which emitted chlorine atoms, which could speed up the process of ozone layer depletion, to the hydrofluoroalkane inhalers in the 1980s, which had less of an impact on the ozone layer but had more carbon emissions. Currently, inhalers with the hydrofluorocarbon propellants are more common, but this still has room for further environmental improvement as the propellant is 370 to 3,300 times more potent than carbon dioxide, and 5 doses is equal to a 15-kilometer car drive. The carbon dioxide equivalent of 1 dose is around 120 grams, which is less than the HFA inhalers, but still very potent. There are also newer propellants that are currently being worked on that are supposed to be more environmentally friendly. However, until that time comes, we need to make sure we remain vigilant about which MDI we use. So to reduce the impact of MDIs on the environment, the ICU can consider using nebulized medications for patients who are intubated and have no airborne precaution. After a patient is extubated, they can also keep their puffers for reuse instead of throwing it out. And although nebulizers may have less do have less carbon emissions, they also may cost slightly more per dose. Another medicine that contributes to hospital carbon emissions are anticoagulants, specifically heparin and low molecular weight heparin, because it is made out of pig intestines. Actually, 1.1 billion pigs are killed per year for these medications. And for each kilogram of pig, there is 6.1 kilograms of carbon dioxide, which in total equals to around 668 million tons of carbon dioxide. The carbon is produced mainly through the live animal production, processing, retail consumption, and packaging, as seen in the graph. So the ICU could consider using low molecular weight heparin, for example, enoxaparin, because less weight means less pig and therefore less carbon. For stable patients, we could also consider using direct oral anticoagulants sooner than later when possible. Recently, we have conducted a quality improvement study on staff awareness on environmental sustainability within the ICUs in the Fraser Health Authority. It included a pre and post survey with a variation of this presentation in between. The data also includes St. Paul's Hospital ICU. A total of 79 ICU staff responded to the survey, and this graph shows you the breakdown of respondents within each ICU. In the pre-survey, respondents were asked about their awareness of environmental impacts from the hospital operations in the ICU on a scale from 1 to 5, 1 being not aware to 5 being fully aware. And as highlighted, most of the respondents were either not aware or somewhat aware. This meant that there was definitely room for improvement for environmental awareness, and my target for the post-survey was either very aware or fully aware after the presentation. And then after the staff viewed the recorded presentation, the ICU staff were asked the same question as before the presentation. However, this time, almost 90% of the respondents were either very aware or fully aware of the environmental impacts. Of note, 98% of respondents to the post-survey said they were willing to change practice in order to save the environment. To conclude, the intensive care unit has several areas for improved environmental sustainability, and in our recommendations, we focus on reusing, reducing, and recycling medical and non-medical products, and using alternative medications. So the next step is to expand this environmental effort to more ICUs provincially with your help. And I'm wondering if this group would be interested in starting an environmental sustainability working group to continue the efforts we're currently doing, but on a more provincial level. Ideally, I would like physicians and various staff members from the different health authorities to be a part of this committee. So if you're interested, please reach out to me. In the meantime, Dr. Wesley Jan, Fiona Howarth, Dr. Vincent Mabasa, and myself will continue to raise awareness on this topic on our end. And I've also partnered with Dr. Masa Mohamedan from St. Paul's Hospital as well to help spread the message to her ICU. Finally, thank you for taking the time to listen to my